Member for Albany.
Thank you. My question is to the Minister for Health. I refer to the Cook Labor Government's ongoing commitment and investment to improve West Australians' children's health system. And I ask, can the Minister outline to the House how this state's budget's significant funding boost for the Children Development Services will improve the delivery of our paediatric and child health services in WA? And can the Minister advise how this significant investment will facilitate a rapid expansion of services and significantly increase WA's children's health workforce?
Good question. The Minister for Health.
Madam Speaker, I thank the member for Albany for her question and on this incredibly important service. As we know, the Child Development Service is a unique service in Australia. Western Australia is the only state that provides a fully publicly funded service which both provides assessment as well as ongoing treatment for children experiencing developmental and learning delays. So that's why it is important that we try and continue to keep up with demand, which has overwhelmed the service over the last 10 years. We've seen demand for referrals to paediatricians actually increase by 123%. Over the last 10 years, and clinical psychology demand referrals by 114%. We're also seeing, with that demand, increased patient complexity and social factors within families, which requires a fully multidisciplinary treatment and care plan around these children to support them in their learning journeys. And it's important that the community know that the Child Development Service is a priority for the Cook Labor Government, and the announcement as part of this budget with $39 million, one of the biggest single injections of funding into this service that we've seen, is a significant injection of funding to support ongoing service delivery in our communities. That will fund over 100 FTE in the service. So over 100 FTE of medical, nursing, allied health, both in metropolitan and regional Western Australia, to provide better access and quicker access for people who need to have their children seen. We know that we need to see children in those early developmental years so that we can have the full impact of treatments. The earlier the intervention, the better their outcomes and the more impactful those treatments will be. We're also, the Child Development Service over the last number of years has been piloting a number of new ways to deliver assessments and care and support for children with developmental challenges, including the piloting of a joint nurse-paediatrician medication pathway, which essentially allows children on medication to have a medication review. Rather than with the paediatrician, the pathway involves a clinical nurse specialist to monitor and manage ongoing medication issues, and often that is an assessment. If there's no complications or challenges, then they can essentially get another prescription. And that's seeing nurse practitioners working at the top of their scope, which is something we're keen to do more of in the system, and frees up those paediatricians to see more children for assessment. We're also piloting the combination of service planning and assessment appointments to allow families to essentially have less appointments and reduce those waiting times. We've also opened a number of child development service centres on the weekends to open up appointments for Saturdays, which for working families is incredibly important in terms of access and flexibility. We're transitioning to electronic referrals to reduce the administrative burden, and we're implementing the hub and spoke model, which will allow those child development services to sit alongside child and adolescent mental health services, which are often viewed, and the experience of patients is that they are siloed and people get bounced between both of those services. So the hub model, which opened recently in the southwest in Bunbury, will allow many of those services to be assessed alongside those mental health services, all under one roof. I spoke to one practitioner who'd been working in the CDS for 17 years because that's where she feels that she can make the most difference. People do love working in the child development service area. They see many, many children and have a genuine impact on people's lives. I'm very proud that this budget and this government is delivering a significant increase of both assessment and ongoing treatment for children with developmental challenges.